Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. Our guest today is returning to speak with us, Dr. Sandy Feldman. She's medical director of Clearview Eye and Laser Medical Center in San Diego, California. And she's returning to the program today to talk about tips to maintain and improve your eyesight. Welcome back to the program, Dr. Feldman. Thanks for taking the time once again.
It's a pleasure to be here today.
For our listeners who are not familiar with you, when you were here before talking about LASIK and SMILE, a bit of your background.
I'm a medical director of Clearview Eye and Laser Medical Center in San Diego, California. My specialties range from LASIK to laser cataract surgery to SMILE and to the topics I'll be talking about today, maintaining one's health and vision. My clientele ranges from women and men in their early 20s to really no upper age limit. At different stages and ages in life, numerous vision issues take place, and that can determine my patient's medical needs. As a doctor, I'm striving to provide my patients with the very best vision and the latest medical options to change their life by improving their vision.
You know, we hear a lot about the flu season, the cold season. Is there a season that is eye care season, or is this something that we need to pay close attention to no matter what time of year it is?
Well, I think it's important. Each season has its unique aspects with respect to the health of our eyes. And in order to maintain eye health, it's similar to maintaining your overall health. Maintaining all regular good habits like eating right, getting enough sleep, exercising are all important to the health of our eyes. And so there's different tips for each season that I'd recommend for keeping your eyes healthy.
Well, seeing as how we're slowly emerging in some parts of the United States out of a very severe winter in some areas. Let's talk about the winter months. You've got sometimes goggles, you're in blizzard conditions, the sun is shining, glistening off the snow. What are some of your tips and hints for maintaining eye health during the colder months?
Well, the hard thing during the cold, right, is you think it may be cloudy outside and you don't have to wear sunglasses or goggles if you're riding a snowmobile or skiing or just walking around in the blizzard conditions. However, you can actually get reflections of the sunlight off of the snow that produces more light and can damage the eyes. There's even such a thing as snow blindness. It's also harder when it's cold outside, you're inside, and there may be less availability of eating, right, and of exercising just due to the weather conditions. But it's important to maintain that during the winter, just as you would during every other part of the year in the spring.
You know, when you're out in the cold and you're covering up exposed skin, it's cold outside, and as you mentioned, it's cloudy, so you don't think you have to wear goggles or anything to protect your eyes. Well, you have to see where you're going. Does the moisture in your eyes get, frozen or anything like that, or does blinking prevent that from happening? That's always been a question of mine. How can we be out in the cold and our eyes don't freeze?
Well, blinking actually moves around the tears in your eyes, and that enables them to be warmer, right, than otherwise where fluid might freeze.
So in addition to eating right, getting some exercise, even if the weather makes that kind of prohibitive, are there any other things during the winter months that you'd like to tell us?
Well, we want to try to, if we're talking about during the winter, we may be using the heat on, and the heat may have a drying effect on our eyes. So we want to make sure that we're drinking plenty of fluids, and also, if necessary for our eyes, using artificial, non-preserved teardrops that will help reduce dryness of one's eyes. Sometimes one may also want to think about using a humidifier and make sure the fan of the heat isn't blowing right in your face. Same thing in your car, because that can lead to drying of our eyes, which then can lead to more discomfort.
What about the transition into spring? You've been doing certain things because of the winter months, and you get into the spring. Should you change your habits as far as eye care? I mean, spring is allergy season. We're talking about different seasons.
Absolutely. So you want to know, firstly, what you're allergic to, if you are allergic or not. There's lots of different things that start to bloom in the spring. And if you have red, itchy eyes, you want to think about, and your nose is running, your eyes are running, you may be allergic. And so the more knowledge you have about what allergies you have, the more you may be able to prevent that by using either, eye drops that can help with your eyes or systemic oral anti-allergic agents. If you do things, also spring's the time when we begin to clean out our homes and we begin to garden. And just with the dirt and dust and mold and mites and things that are present in the air or the ground, again, people may have allergies, or we may be getting, dirt and other things in our eyes. So often people forget to wear eye protection when they're doing things. And from both the safety, the glasses, if you're outside, sunglasses, if you're indoors, even don't forget to wear protective goggles that will protect your eyes from the dirt and dust getting in. In addition, protective eyewear is critical to prevent eye injuries. Hardware, sporting goods stores have lots of non-prescription eyewear for these purposes.
Now, would you say that the precautions taken during the spring are pretty much the same as the summer, with maybe a little exception as to humidity and things of that nature? When it comes to swimming, summertime is the time for swimming. You may be doing the lake, you may be doing the pool, or even the ocean. What about some tips and tricks for, summertime eye protection and health?
Well, when you're swimming, as an example, you want to use goggles. If you wear contact lenses, most people continue to wear those when they're swimming. However, you really shouldn't. You're supposed to take those out when you go swimming. And especially, there are some microorganisms that you can get in fresh lakes some amoebas that can be quite damaging to the eye and occur more in, fresh water. When you wear contact lenses, there's also an increased incidence of infections. So you want to make sure that you're caring for contact lenses properly. Many, many people, have bad habits when it comes to contact lenses. It's important to always wash your hands, to take the lenses out nightly, to clean them in solutions, not reuse them, not wear the contacts longer than you're supposed to wear them for, and, washing your hands before you put the lenses in or when you take them out. Maintaining good hygiene, changing our solutions. And people forget to actually change the cases that they put contact lenses in. And some of the cases that people will pull out of their pockets or purses are not something you really want to have, close to a part of your body. They're quite dirty. And we forget that inside the cases and solutions, there can be microorganisms that if they get in our eyes, it can be quite damaging.
You touched on it, but talk about the importance of drinking lots and lots of water. That could prevent you from having to use those artificial tears.
That's correct. So drinking lots of water will keep your body hydrated, and it helps your eyes produce enough tears and helps them keep moist and comfortable. And another thing, that people use the computers and cell phones nowadays, and we often stare at them. And we're texting so much that we don't blink enough. We're concentrating on what we're doing. So it's important to take breaks from the close work we're doing, look far away, and blink 20 times. Probably one of the most important things to think about is to have some season, maybe around your birthday or a season, that you want to schedule your annual eye exam and make it a yearly habit, because your eyes are the windows to your world, and we want to maintain them so that you can see and, keep your activities how you want them to be.
Well, Dr. Feldman, I thank you for coming back and talking with us today. Where can our listeners go and get some more information about Clearview Eye and Laser Medical Center?
We're located in San Diego, and you can go online at clearvieweyes.com. ClearVieWeyes.com.
It's been a pleasure, and I'm hoping that we'll have a conversation in the future. Thanks for joining us again.
Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Sandy Feldman, Medical Director of Clearview Eye and Laser Medical Center in San Diego. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.